Tuesday, and this is your dose. So, 2020 is off to an interesting start. The Australian Prime Minister got called a fuckwit to his face. World War-saving diplomacy happened live on Twitter. We found out Uranus is, no joke, leaking gas. Apparently, the tooth fairy is more important than actual dentists. Weird times. Well, except for that Prime Minister thing. That actually sounds about right for Australia. Anyway, with face mask selfies trending and many countries currently doing their best Mortal Kombat cosplays, the US Center for Disease Control has officially joined the game. They're now recommending the use of cloth face coverings to help slow the spread of COVID-19. This does not align with previous statements by both the World Health Organization and even the US Surgeon General. With so much seemingly conflicting information around, let's take a look at the scientific literature to see where this advice is coming from. For those of you that aren't keen on watching this whole video, here's the summary. It's complicated. Masks might help a little bit if used correctly, but they're not as important as social distancing and personal hygiene. Let's get to it. As of 29 March, the World Health Organization has maintained that COVID-19 is not airborne. And by airborne, the WHO is not talking about large mucus or saliva droplets that are expelled from your nasty face. Airborne transmission refers to tiny particles, less than 1/10 the diameter of a human hair, resulting from coughs, sneezes, talking, and possibly even just from breathing. However, recent findings of virus RNA in hospital air and on surfaces has called this into question. Additionally, recent laboratory studies have suggested that the coronaviruses can not only exist in aerosols, but they can persist in lab-created particles for up to 3 hours. Now, it is important to note that just because virus RNA has been detected somewhere doesn't mean that it is in concentrations large enough to infect someone. More research is certainly needed. Despite this, some experts, like Dr. Don Milton at the University of Maryland, have claimed an approach that assumes it is not possible for COVID-19 to transmit via aerosol is actually irresponsible, and instead, we should take a more cautious approach. If the virus is indeed airborne, of most concern would be indoor environments, where aerosols ejected from an infected person can hang around for minutes or even hours. Simulations show that without appropriate room ventilation, these tiny particles can travel in the air for more than just 2 meters. With these factors in mind, the US has now changed their stance on mask use. But do masks actually work? Well, potentially, but remember, a face mask is only as good as its fit. Air will travel in a path of least resistance, so if a mask does not fit tightly around your face, it's not going to do anything. And the type of material used is key. Household fabrics generally have various levels of uselessness, while surgical masks are usually about twice as good as homemade masks. However, even they are still far from ideal. The best option of the lot is N95 masks, which filter out at least 95% of non-oil particles. There's high demand for these though because healthcare workers absolutely need them. Proponents for mask use say that they could be used to prevent transmission from sick individuals. And that too was actually rather uncertain. While studies have shown that wearing masks can reduce expelled particle loads, especially larger droplets, there are clinical trials that show in practice masks might not be as effective as we think. For instance, despite popular belief, the wound infection rates in operating theaters are unchanged whether surgeons wear masks or not. Overall, there isn't a consensus on how useful masks are, but there is some thought out there that they could help to some degree. So even if masks might be able to help, even just a little bit, why weren't they being recommended? Well, for one, we need to save the masks for people that actually use them. I know you feel like you need one when there's some mouth breather 2 meters behind you in the checkout queue, but that's nothing compared to a nurse that is intubating a severe case directly in front of them. I know humans are historically not great at thinking of others, but let's really try to give it a go on this one. Secondly, it's been pretty well documented that people are idiots. And because of this, the World Health Organization more or less thinks that we're too stupid to use masks properly. This is pretty insulting, but based on what I've seen so far, it might actually be onto something. Research has shown that 76% of people don't use masks correctly. And honestly, that seems pretty generous. Also, masks might give you a false sense of security that can lower your overall protection. And finally, as early as April, we still don't know for sure if the virus is airborne. Hence, the World Health Organization's recommendations, which, of course, are currently under discussion. As far as what you should do going forward, although I have a background in aerosol chemistry, I'm not an expert in respiratory protection and infectious diseases, so my opinion should not be treated with the same credibility. I think we all know what happens when a non-expert, like, say, an addiction medicine specialist, starts giving advice on a pandemic.
Mild, doesn't hurt anybody. That should be the headline. Way less serious than influenza. That's the headline. The flu virus in this country is vastly more consequential, and nobody is talking about
this
that.
Corona thing doesn't worry me at all.
It is a press-induced panic. I am angry about it. It is the flu.
Who knew a TV celebrity wouldn't be credible? That being said, I do feel comfortable relaying what I have gathered in the latest scientific reports and expert opinions. So here are some of the consistent themes I found on what you should do regarding the possibility of an airborne coronavirus. First and foremost, stay the fuck away from people. You don't want to put yourself in a situation where you need to rely on a mask that probably won't fully protect you. The current recommendations say keep at least 2 meters apart. If you are worried about airborne transmission, you are more than welcome to distance yourself by more than that 2 meters. Number 2, limit your time in indoor environments. When you go to the supermarket, have a list, have a plan, and be efficient. Now is not the time to wander around for an hour like a blazed James Franco looking for a box of Crunch Berries. In an addendum to that, businesses should evaluate their ventilation strategies to ensure they have consistent airflow inside their stores. Clean airflow is important. And finally, yes, it may help to use a mask, if done so appropriately. This means putting it on and taking it off correctly using clean hands, making sure it has a tight seal around your face and that you are not constantly having to readjust it. This is, of course, in conjunction with guidelines on social distancing and personal hygiene. Don't rely on a mask to protect you. But as long as we're speaking about proper use, it's not just masks, but gloves too. Anytime you need to use these PPE, you should imagine that everything on the outside of them is now contaminated. Oh, your gloves have given you the confidence to touch every freaking avocado in your search for the perfect guacamole. Well, you're a dick. And now you have coronavirus on your gloves. That means everything else you touch after that, your face, your credit card, your car door, are all now contaminated. Same thing with your mask. Once you start breathing through it, assume the outside of it is now contaminated with coronavirus. So even if it's uncomfortable, never touch the outside of the mask once it is secure, especially when you're taking it off. You need to consistently think about your PPE and how you need to safely remove it after it has served its purpose. So when it's all said and done, right now the best thing we can do to help save the world is just sit back, relax, and immerse ourselves in the musings of a gun-toting Oklahoma man with a drug addiction and hundreds of pet tigers.